Hello friends, welcome back to the Healthcare Today. Today we are going to discuss about the most common thing which is called allergies. As you can see, with the changing weather, most people complain of allergies. Some people complain of dust allergy, some people complain of allergy to a particular pollen. So as a doctor, it is my duty to explain you how allergy happens, how does we diagnose this problem, and how to treat it and how to prevent it. So as you know, allergy is a genetic disease. Most common cases, your grandparents or your parents must have some sort of allergy which is genetically transmitted to you, which acts as a predisposing factor. So we as a doctor, we never understand which type of allergy you have unless you go to your nearest doctor and get the properly evaluated for that particular disease. So once you have a particular symptom regarding the involvement of a particular organ in the body, but for example, if you're having allergic skin, you tend to have rashes, lot of itching and lot of pruritus. Similarly, if you have allergy of eye, your eyes will be watering, there will be redness of eyes, there is always congestion in your eyes. So depending upon the organ involved, allergies may have different type of presentations. So once you observe that after getting exposed to a particular thing, for example, most common people have problem with dust, house mite, as well as petrol fumes, good night, all out, and all these things are the most common allergens available. And most commonly we are seeing dust allergy because of the lifestyle change which are adapting to the new world. Most of us are being constantly exposed to dust, which leads to severe cough, sneezing and multiple other symptoms. So once you get to know that you are having allergic symptoms, you meet a doctor. What does the doctor do? Once you meet the doctor, he'll explain you, he'll assess all your symptoms and get a simple test called comprehensive allergy testing. So this is a test where around 300 to 700 antigens are tested and we get the report in terms of mildly reactive, moderately reactive and strongly reactive. So once we found out that there is a particular thing which is bothering you, we ask you to avoid that particular thing. That's the best form of therapy. But most of the cases, most of the patients and most of the blood reports are negative. So the patients are again confused that why this allergy is happening. In those cases, we have a simple test which is called serum IgE level. So once we assess this is an indirect way of telling you how much allergen load is happening inside your body. This IgE is an antibody which is produced inside the body once you are exposed to allergen. So if the total IgE value is high, that means you are having more allergic exposure. That means you are having more allergen load. So you automatically qualify for allergic treatment. So once we know that you are allergic and we establish the allergy is severe, we form a certain treatment for you regarding the organ involvement. For example, if the skin is involved, we give you ointment. For example, if the eyes are involved, we give you eye drops. Similarly, if the airway is involved, which we call it as asthma, we give you inhalers. So initially we start with a low dose and we try to step up and step down depending upon your requirement. Once your allergy is completely controlled, we may try to stop the medication. Most patients, roughly 90% of patients, they tend to have allergy only when there is change of weather. When there is extreme temperature fluctuation. For example, these days you can see in the morning the temperature is around 36 and night the temperature is around 23, 24. This fluctuation of 13, 14 degrees temperature cannot be handled by the people who are allergic to the particular season change. So these patients, they tend to have symptoms. So always when you feel this problem, please consult an allergic specialist or a pulmonologist. So once we assess your symptoms, severity of symptoms, we set a treatment for you. And nowadays, I also want to tell you about the new therapies which are called biologicals. Once we found that you have a severe allergy, for example, the initial form of therapy or initial treatment is not helping you. So there are particular injections which are available in the market. One injection is given every 15 days, the other injection is given every month. So once we found out that you are having severe allergy, these injections will be offered to you. And with these injections, we are seeing people respond beautifully and their symptoms were being under control and they doesn't have any further symptoms. Once you found out that there is particular allergy symptoms in the body, please free to consult a pulmonologist or allergy specialist. And these days allergies are completely controllable. Don't panic. Please meet a doctor to help you. We care about you.